Hello. I want to tell you a story today. A lady who came into my office last week apparently had seen me 10 years ago. And my office manager told me that she was coming and asked me if I remembered her. And I said, no, I did not. And she said, well, this lady was here 10 years ago. And she says now she wants to do anti-aging and hormones and everything. So I was a little curious. And when the patient came in, she said, hi, doc. 10 years ago, you recommended that I start bioidentical hormones. And I really wanted to. But then I went and discussed it with my GYN. And my GYN scared me and told me that they cause cancer and they're dangerous and all kinds of other things. So I didn't do it. So I said, okay, well, what changed? Why are you here now? So she says, well, last week, the same GYN called me and asked me if I wanted to do bioidentical hormones because she's doing it now. And that made her realize that, wait a minute, 10 years ago you told me that it was dangerous. So I asked the patient, I said, well, what do you think caused the change? And she says, I don't know. And I said to her, I'll tell you what changed. The GYN now is 10 years older and she needs hormones herself. And guess what? Now that she needs them for herself, she went out and did the research. And she wants something that's really good for her, as opposed to just taking any old thing, which is what they're willing to hand out to other patients. So what does this have to do with you? Well, look at it this way. 10 years, this lady was deprived of quality of life for 10 years. Things that she could have done differently in those 10 years. There's also a sense of loss. Loss of maybe activity, arthritis, hair, loss of her job, loss of her partner, loss of her joie de vivre, all kinds of things. Maybe family members couldn't stand to be around her because of her hormonal transition, and so on and so forth. Hormones do so many good things for you. And the idea that this lady was deprived of that for 10 years just based on a rumor is super sad. Anyway, so now she's on her hormones and I will be seeing her soon. I want to tell you another story about a patient that I saw this year. And this young man, I use the term lightly, he's in his 60s. He is a nurse. And so he's always prided himself on being pretty healthy, and he knows lots of doctors, and if he needs a little something, they can help him at work. So one day he called to make an appointment. In fact, the appointment had been made for him by the hospital. And the first thing he said to me was, I don't know why I'm here, but they made the appointment, so I guess I'll, go along with it. So I said, well, why did they send you to me? And he says, well, I had heart failure. This was a big surprise to me. This gentleman's not overweight, and he stays relatively fit. So I said, well, what caused your heart failure? And he says, nobody knows. My ankle swelled up, I had difficulty breathing, I went to the ER, they told me I had heart failure, and they gave me some medicine. And so I'm going to see the cardiologist in a month, and I'm feeling better now. So it occurred to me that something was not adding up, and I said, the cardiologist said to see him in a month. How about we do one little test while we're waiting? And as it turned out, that one little test basically saved this gentleman's life. He had a cardiac bypass a week and a half later based on the results of the test that I recommended for him. So sometimes there's a reason why it's good to talk to somebody else, even when it's not a specialist. And it's also helpful to have more than one person look at your situation. So where I'm going with this is that I am open and willing to talk to anyone about anything that concerns them in the medical field. They do not have to be my patient. If you have friends or neighbors or relatives who have questions or need a second opinion or don't understand what their doctor told them, please refer them to me, and I'd be happy to have a 30-minute teleconference with them to see if we can get to the bottom of what might be helpful for them specifically, and also to answer any questions they might have. Let's look at different options before you jump in the deep end. So I'm available to talk to anyone, and of course my patients I'm happy to take care of them anyway, so they don't need to schedule special appointments. But my point is that there are often more than one way to skin a cat, and you don't want to be in a situation where you say, I shoulda, woulda, coulda, if only I had known. So I know that there's Google and I know that there's WebMD, but looking at something online is not the same as having someone address your specific concerns regarding you in particular. So anyway, I hope that this little talk has been helpful to you, and think about it. If you're not sure of something, pursue it until you have cleared your mind enough. Don't wait 10 years to get it figured out. That's the end of my talk for today. Bye.